Thank you. Some Democratic state lawmakers say they're concerned about the effects of new federal work requirements on Medicaid users here in Indiana. News 8's government reporter Garrett Bergquist looked into this issue for this week's episode of All Indiana Politics.
The Congressional Budget Office estimates Indiana would lose 15% of its Medicaid funding over the next 10 years. State Representative Carrie Hamilton represents northeastern Indianapolis in the General Assembly. She says Indiana is one of the states that most depend on federal spending. She says exemptions to both state and federal work requirements for Medicaid won't work.
Well, the challenge is this bill is creating a whole new bureaucracy when the Indiana Republicans have shown they support with the new state budget doing similar requirements. So we're creating paperwork for folks to prove their eligibility. And as other states have rolled this out, including Georgia, for example, they've shown that people who are eligible, who are working and are eligible, have a hard time proving their eligibility because the system is so complex. So we understand that many people will lose health care who are eligible simply because we're spending all of this money to create a bureaucracy that they can't navigate. It's really designed to fail them.
Senator Todd Young says the One Big Beautiful Bill Act will deliver the largest tax cut in history for working and middle-class Hoosiers, expand the child tax credit, spur new economic growth and job creation, and advance President Trump's agenda. He also praised its investments in research and development and in the military. Be sure to tune in for All Indiana Politics as we take a deep dive into changes to Medicaid at both the state and federal level. It airs at 9:30 this Sunday morning, right here on Wish TV. I'm Garrett Bergquist for Wish TV and WishTV.com.